It's 3:12 a.m. and ouch, something just shot through my molar. I sit up, breathe, and think, is this worth a dentist visit right now, or can I do something gentle from the kitchen to get through the night? Hello and welcome to Earthy Remedy. Listen to your body. We're going to walk you through safe, short-term steps and clear limits.
If you have fever, facial swelling, spreading pain, pus, or trouble breathing or swallowing, stop home care and seek urgent dental or medical care now.
Okay, deep breath. That quick warning first. I'm Samnang, your host and wellness guide. With me is my brilliant co-host Fiona and two guests who will help us separate what's safe from what's risky. Dr. Patel, periodontist, and Maya Liu, clinical herbalist. We'll keep this practical, safety first, and with exact measures, whether you use metrics or cups. Full notes and a printable checklist live in the show notes.
Hi everyone, Fiona here. Today we'll talk about things that commonly cause trouble: tooth sensitivity, mild gum inflammation, and transient bad breath. The goal is steady relief you can try between appointments, not to fix structural problems or infections. The research shows home care can ease symptoms when the cause is self-limited, but we'll be clear about the limits.
Samnang again. Before we get into demos, Dr. Anna, can you walk us through the big red flags people need to know? I want listeners to feel safe and also empowered.
Absolutely. The urgent signs are fever, facial swelling, especially if it makes one side of the face look puffy, spreading pain that moves beyond a single tooth, any pus or drainage, and trouble breathing or swallowing. If you have any of those, stop home care and seek urgent dental or medical care now. For persistent, severe pain that won't respond to basic measures, make an appointment. Some problems need in-office treatment.
Thanks. Let's be clear. Home demos are for short windows, like 1 to 3 days of symptom relief while you schedule care. From a biochemical perspective, rinses and mild topical agents can reduce local inflammation and surface bacterial load, but they won't repair fractures, abscess cavities, or advanced periodontal disease.
That clarity already helps. I felt less panicked hearing what absolutely needs a doctor. Now, quick prep checklist before we demo. Have a small pot or kettle for brewing, a clean mug or jar, a teaspoon and a measuring spoon, a small dropper or cotton swab for spot work, and a timer or phone. We'll give metric and imperial measures as we go. Also, patch test reminder for topical swabs. Test a tiny amount on your inner wrist and wait 10 minutes.
And I'll say, the patch test is non-negotiable for concentrated herbal work. A little caution now prevents a lot of trouble later. Also, if you're pregnant, breastfeeding, a child, or immunocompromised, please pause and check with your provider before trying topical herbal preparations. Quick reminder, if you have fever, facial swelling, spreading pain, pus, or trouble breathing or swallowing, stop home care and seek urgent dental or medical care now.
Demo A, cooled green tea plus salt anti-inflammatory rinse. This one is the gentlest place to start. Maya, walk us through the exact recipe and why it's helpful.
Okay, this is simple and kitchen-friendly. Ingredients: 1 cup of freshly brewed green tea, that's 240 milliliters, cooled to lukewarm, and half a gram of plain table salt, which is roughly 1/8 teaspoon. Combine the cooled tea and salt, stir until dissolved. The tea brings mild anti-inflammatory catechins, and the salt helps with gentle osmotic cleansing. Take a sip, swish for 30 seconds, and then spit. Repeat up to twice a day for a maximum of 3 days while you monitor symptoms. Don't swallow the rinse. Store any unused rinse in a covered jar in the fridge for up to 24 hours. Reheat to lukewarm before using.
A couple of cautions. This rinse is low risk, but if you're on photosensitizing medications or have a specific medication list, check with your provider. Also, if symptoms worsen after using it, stop and consult a clinician. The bottom line is this is temporary symptomatic care, not a cure for infection or structural issues.
That felt soothing when I tried it once. Warm, not hot. The mouth felt calmer almost immediately. One-line tip, don't use mouthwash with alcohol right after. It can dry and irritate.
Good practical tip. And remember, if you develop new redness that's spreading or any fever, stop home care and seek urgent care now.
Bridge, Patch test reminder again, especially for our next demo. Ready for Demo B? Clove ginger spot swab for a brief pain relief.
Yes, this is for short, localized pain. Think a localized toothache area, not widespread infection. Ingredients and dilution. Brew 1 tablespoon, 15 milliliters, of strong ginger tea. Use a small pot or steep ginger slices in hot water for 5 minutes and cool. Into that 15 milliliter carrier, add 1/8 teaspoon of ground clove. Stir well until it disperses. That creates a mild topical eugenol dilution. Important, perform a patch test. Place a tiny drop on your inner wrist, wait 10 minutes. If there's redness, burning, or swelling, do not use it in your mouth.
From a safety perspective, clove oil and concentrated eugenol can irritate or cause reactions if used too strongly. That's why this dilution and the patch test matter. Also, not recommended for small children, people who are pregnant or breastfeeding without clinical approval, or those who are immunocompromised. If you have a known allergy to cloves or strong spices, skip this.
How to apply, Maya? Walk us through step by step for anyone listening and cooking along.
Step 1. Do the patch test, tiny dot on the inner wrist, wait 10 minutes. Step 2. If no reaction, soak a clean cotton swab or a sterile gauze in the diluted clove ginger solution. Step 3. Gently dab the swab on the sore spot for no more than 10 to 15 seconds. Step 4. Remove and discard the swab. Step 5. Rinse your mouth with plain water after 5 minutes. Max frequency, up to 3 spot applications in a 24-hour period and only for 2 days while you schedule care. If pain persists or worsens, stop using it and see your dentist. Never place a concentrated oil or undiluted clove directly on tissue. Follow the dilution exactly. If you notice persistent numbness, increased swelling, or a burning sensation, stop immediately and seek care.
Noted. I can picture that tiny, warm clove scent. Very comforting if used carefully. Okay, Demo C. Baking soda paste for odor and gentle surface stain softening. Fiona, take us through the ratio and enamel protection steps.
This is a low abrasion approach. Use it sparingly. Ingredients: 1/4 teaspoon of baking soda, that's about 1.25 grams, and just enough water to make a soft paste. Start with 1/4 teaspoon, about 1.25 milliliters of water, and add dropwise. Metric alternative, 1.25 grams baking soda plus about 1.25 milliliters water. The idea is a soft paste, not a gritty scrub. Step by step. Step 1. Wet your toothbrush slightly. Step 2. Place a very small amount of paste on the bristles. No need to cover the whole head. Step 3. Gently brush the tooth surface in one area for 10 to 15 seconds. Do not scrub back and forth hard. Step 4. Rinse thoroughly. Use this as a single-use application for stubborn odor or a surface spot. Limit to 1 application every 48 to 72 hours and no longer than a week total for an ongoing issue. This protects enamel and avoids abrasion that can increase sensitivity.
A practical swap: if you don't have baking soda, try a plain water rinse and the green tea rinse instead. Also, avoid adding acidic agents like lemon to baking soda. Acid plus abrasive equals enamel risk. Exactly. Do not use alkaline or abrasive paste repeatedly. If you already have sensitive enamel or receding gums, skip the baking soda paste and stick to the rinse. And again, if you see pus, swelling, fever, or spreading pain, stop home care and seek urgent care now.
Okay, 3 safe short-term options, each with exact limits. Now let's talk about how to try these responsibly. The 2-week micro trial and tracking plan.
Pick one demo at a time. Use it as directed for no more than the short window we gave. 3 days for the rinse, 2 days for the clove swab. Single baking soda applications every 48-72 hours. Track 4 simple metrics daily. Pain on a 0 to 10 scale, bleeding on flossing, yes, no, breath confidence, 0 to 10, and any new signs like swelling or fever. If any of the red flag signs appear, stop and see a clinician.
We made a printable trial tracker you can download in the show notes. Low bandwidth option. If you don't have social media, email hello@earthyremedy.fm with oral care trial in the subject, and we'll record your submission for the community feed. And remember, the patch test is only for topical herbal swabs. Rinses don't need that, but do watch for taste-related nausea or irritation. A note on special populations: children, pregnant or breastfeeding people, and immunocompromised listeners should consult their clinician before trying the Clove swab or any topical herbal preparations. The rinses are lower risk, but still check medication interactions and your clinician if unsure.
Sourcing and hygiene in 3 quick points. Use food-grade ingredients. Avoid essential oils used undiluted in the mouth, and always use clean utensils and fresh water. If you're buying spices, choose a small jar you'll use quickly rather than one that's been sitting for years.
Don't put undiluted essential oils in the mouth. They're concentrated and can burn mucous membranes. If you see advice online that suggests drops of oil directly on a tooth, ignore it and refer to a trusted clinician.
We've linked clinician-reviewed sources in the notes, including ADA guidance and a couple of systematic reviews that relate to rinses and topical agents. Our aim is evidence-aware, not alarmist. Use these demos to feel steadier between visits, not as a replacement for care.
Reflection. Small, consistent, safer home care gives you agency while you get professional care. One small step, like a gentle rinse or a careful patch test, can help you feel more grounded. You've got this.
Final safety reminder: if you have fever, facial swelling, spreading pain, pus, or trouble breathing or swallowing, stop home care and seek urgent dental or medical care now. These demos are for brief, supportive relief only. If you try one of these, do the patch test when required. Track what you notice and be gentle with yourself. Healing is often incremental. Notice how small actions change your comfort.
We want to hear how this went. Tag @EarthyRemedy. Post a quick note, or if you prefer email, use hello@earthyremedy.fm. Download the red flag checklist and the 2-week trial tracker from the show notes before you try anything.
Thanks to Dr. Anna Patel and Maya Liu for guiding us with clinical and herbal clarity. Remember, listen to your body, trust the earth, and feel the difference. We'll be back next week with another simple, evidence-aware remedy. Take care of your mouth. It's part of your whole self.